Miguel Alonso, and
I'm Kira Stubbs.
and we're here to talk about sickle cell anemia. This is a project for our biology class, and we are trying to figure out genetics. This is one of the genetic disorders that can occur in a human. Now, tell me more about your disease or disorder, or how it is that you get it.
Well, sickle cell anemia is when two parents have two mutated traits, basically saying that you have two recessive genes, which is passed down through like a line of children.
Okay, cool. Do you know if your parents or grandparents had it?
Actually, I know my grandmother had it and an aunt of mine had it.
Oh, yikes. Were you born with it? How do you know? How do you know now that you have sickle cell anemia?
Well, I was born with it, but there are some symptoms like swollen hands, swollen abdomen, and pain.
On a scale of 1 to 10, what would you rate your disorder?
As far as pain, I would rate it mainly above a 10, or it depends on the weather or certain conditions of your body.
Okay. Oh, man. Do any other relatives have this disease?
Yeah, like I stated before, my grandparents, some other relatives down the line that I'm probably not even sure of.
Maybe don't know.
Yeah.
Okay. Is this a rare disease in your family, or?
No, not really. I mean, every so often, like somebody will have it. Like I'll ask about it, and someone will have it.
Okay. Is there any ups or advantages to the disease?
Not really, not that I know of.
Oh man, I would take advantage of it. I'd be like, hey, I got sickle. I don't even know how to say it. Okay. What are some of the symptoms?
Some of the symptoms could be pain, swellingness, and many other things that could be like your liver and other organ failures.
Okay. Is it difficult living with the disorder?
It is pretty difficult because sometimes, like with changes in weather and different activities, that you really can't do them. So.
Okay. Are there any cures or antibiotics available for it?
There is some cures. Some cures will be blood transfusion. There's also bone marrow transfusion, but there's an extreme risk to both of those cures. So mostly antibiotics and medications are recommended.
That's what you'll get.
Yeah.
Are you aware of the complications sickle cell anemia can lead to, like stroke, acute chest syndrome, pulmonary hypertension, organ damage, blindness, skin ulcers, gallstones?
Yeah, I'm aware of all of these. The doctor kind of explained it to us. Most people actually do get some of those diseases. Some people don't. It just depends on how healthy your body is and
how
stuff.
good you take care of yourself.
Yes.
Okay. Do you take any antibiotics?
I'm supposed to take antibiotics. I really don't like to take my antibiotics.
Why?
It just kind of like makes you feel iffy, kind of slows you down a bit.
All right. Have you ever been treated differently because of it? Because of the disorder?
Most people actually do. They treat us like we
Us?
have like people that have like sickle cell anemia. Most people, they treat it like you have like a disability. Like like we can't really do things for ourselves, but which is not really the case. We can. But yeah.
Hey, trying to help you out. Okay, so I understand that sickle cell anemia has a certain tail, poker face tail, which would be swollen hands and feet. Did you ever have that?
I'm not really sure. I would have to ask like my parents about that, but as far as I know, no.
Also, I recently read that another effect of sickle cell anemia is jaundice, which I believe has something to do with the liver. Can you?
Jaundice really does have something to do with the liver. It's the yellowing of the skin and eyes. It's when your liver starts to fail or starts to dysfunction. That's basically all that jaundice is. Most patients get it. Some patients don't. It just depends.
You're one of the ones that did.
Yep.
All right, and there's also the delayed growth symptom and problem with vision. How about you tell me more about that?
I did unfortunately get the vision side. I can't really see from far away, and that's going to happen over a progression of time. That it could progressively get worse. As far as the growth hormone or the symptom, I didn't get that one.
Hey, I see you, fool. All right. Have you ever experienced a crisis? Do you have?
Actually, I've experienced both of those. Usually, crisis lasts for about an hour, maybe two.
Crisis like
it's extreme pain, in your abdomen or somewhere around your body. You'll get it. It's like in your abdomen starts swelling, like you said. It's on the scale of 1 to 10. Some of the pain can rate like over 10, maybe like a 12, or it can be like a 6. That's as far as it's gonna
go. Okay. Tell me about blood transfusions.
Blood transfusions is recommended if you have sickle cell anemia very bad. You can do a blood transfusion. Most doctors wouldn't recommend it because of the high risk that you could actually die from the blood transfusion.
Okay.
Yeah, that's about it.
Tell me about the bone marrow transplant.
Bone marrow transplant is when a doctor takes a needle about that long. Yeah, and it goes in through your spine. He's actually just cleansing you out a little bit. Most patients do get it, most patients don't. It just depends on what your parents believe in and stuff like that.
Okay. And supplemental oxygen, what's up with that?
Supplemental oxygen. Okay, supplemental oxygen is when you take a medication like I would for the supply of blood. Because see, your cells are round. Mine's are more
half round.
Yes.
The thing with I'm sorry, let me explain to the class. The thing with sickle cell anemia is that your cells aren't shaped like not average, but normally born humans. Their cells are actually a crescent moon, like half moon, and they travel the opposite way in your vein. So our cells travel to transport oxygen. Their cells work opposite way, and they get stuck in the vein, which causes pain. Am I right?
Yes.
Okay. Sickle cell anemia is a very, very serious genetic disorder, and it's not something that you should take lightly. Like, for instance, my friend here, she needs to take her antibiotics, and she doesn't. But we hope that you enjoy this video that we made, and hope that you understand sickle cell anemia that much more. Thank you. Bye.
Sickle cell disease is a blood disorder that is inherited from both parents. This disorder is more common in certain ethnic groups, such as African Americans, Arabs, Greeks, Italians, Latin, and Native Americans. Normal red blood cells are very flexible and are circular in shape, resembling a donut. Their flexibility and shape allow them to travel freely through small blood vessels called capillaries. In persons with sickle cell disease, the red blood cells become crescent or sickle shaped and also become inflexible. The abnormal cells stick inside the capillaries, blocking blood flow to vital organs. Persons with sickle cell anemia can have symptoms such as yellow appearing eyes and skin, pale skin, delayed growth, bone and joint pain, increased risk for infections, development of leg ulcers, eye damage, anemia, and damage to the organs affected by the obstruction.